going to move on to imaging the mandible, so we need to reposition our patient. There are two different ways that we can do this. We can put the patient in lateral, or we can put them on their back to image the mandible, and it's a matter of personal preference. So we'll start with putting him somewhat lateral, not necessarily rotating the entire patient. So we want to go ahead and move our tube head. We want to take our sensor out and make sure that it's protected. So now we want to make sure to disconnect him for safety while we're moving him. So instead of rotating the entire patient, we're going to pull this leg under, and this will turn him in a more lateral position without rotating the entire body. We do still want to keep him somewhat level, and this gives us space to put our tube head below his mouth a little bit. So we're going to start with imaging our third molar. So we're going to take our sensor and we're going to use a piece of gauze, and we're going to create kind of a sandwich with our gauze, and this just helps stabilize it and keep it in place. So we're going to go ahead and image the third molar. This one can be a little bit of a challenge because sometimes it's kind of up higher on the mandible, as it kind of gives a little bit of a curve. So we're going to open his mouth, slide our sensor back, position our sandwich, and essentially if I feel down here, I can feel this sensor, but it's essentially going this way. Since we have the space in between the mandibles, we can do these nice parallel shots. So we just want to make sure that it kind of stays where we want it to stay. We don't need to worry about the angle of the tube head, we just essentially want to be perpendicular to that sensor. So now we're going to bring our tube head in. We can be perpendicular to the sensor since we're doing a lateral shot. So we're going to slide it in here, just feel where our sensor is and make sure we're going to expose it. We're ready for our image. So we have a great view of our third molar, and we also have the bulk of our second molar also. Certainly this distal root is fully covered, and maybe just ever so slightly the corner of that more rostral root. So now we're going to move our sensor forward for the next image, which will include the first molar. So we can just slide our tube head out of the way, and then we're going to pull our sensor forward, keeping our sensor sandwich in place. And we may need some additional gauze. Since the roots of our tooth are down here, we want to make sure that our sensor is deep enough to get our image of those, so we need to keep it down, and all this soft tissue in here wants to push it upward. To aid in our positioning for this image, we're going to take several gauze squares. We're going to fold them into kind of a sandwich here, and we're going to wedge these in between the two jaws, upper and lower. I'm going to use the corner of this tooth in that fold in the gauze to help hold it in place, and this helps keep my sensor deep enough into the roots to get the image that we're looking for. And again, this is a parallel image, so we just want to be perpendicular to the plate when we move our tube head in. And we're ready for our image. So our image is available. We'll go ahead and make it a little bigger. So we do have our entire first molar from basically the cemento enamel junction here all the way down, and we do have an image of that area on the first molar that maybe we shaved ever so slightly in our previous image. Okay, so now we're ready to move forward and get our next image. So we're going to go ahead and remove our gauze, and at this point we want to move our sensor further forward, and there is a point where we hit the symphysis and we just can't go any further. So you want to kind of get as far into there as we can for our image. And again, this is going to want to shift on us, so we can use our gauze squares here again to help hold things in place. And you can see that on major here we can get about that far forward and we're just kind of stuck. So now we're ready to move our tube head into place. This is also a lateral shot, so we want to be essentially perpendicular to the plate. And we're ready to take our image. So we'll make our image larger. So for major, We got a nice image of our fourth premolar here, and we can see there's a little bit of space. And I wasn't able to move my sensor any further forward, so the rest of the views of these teeth we're going to have to take using the angles. So we just can't get any further forward. His mandibular symphysis is in the way. So now we're going to go ahead and readjust to get the rest of these premolars. We're going to move this back out of the way. We're going to take our gauze out, pull our sensor out. Now we are going to be going back to a more flat position with our sensor and shooting the angles again. So we're going to fold this, and we've got an even bigger bit of gauze than we had before. We're going to fold this. We're going to essentially put it on top of our sensor, and it's going to help to hold that in place. So we do want the crowns of our teeth along the edge of the sensor, just like we did in the upper jaw. We want to try and hold that in place so that it doesn't move on us. Then we want to take our tube head. We want to find what's essentially perpendicular, take note of it on here, and then we want to raise it by 30 degrees. Now we're ready for our image. So now we have our other image, and we can see that we've included all of that first premolars, so that little section that we missed on the previous radiograph. So now we're ready to move on to our canine tooth. So for the canine tooth, we want to just move our sensor just a little bit forward. We're very close to where we want to be, and then we just want to take our tube head down, and we're going to essentially be parallel to the plate for this one. Now we're ready for our image. So our image is available to view. We're going to make it larger. And now we can see that we've got quite a bit of this canine tooth coming down, and we will see a little bit more of it when we image our incisors. Major is a big dog, so we're not getting much of this other canine. We can just see a sliver of it here, but on occasion with a smaller dog or a cat, you may actually be able to image both of these canines in this view. So now we're going to move on to incisors. So we're going to move our sensor forward so that it's positioned up underneath the incisors. This is a near parallel technique, so we're not quite fully parallel. So we do want to come just from the front like this, and this will make our incisors a little longer. Let's go take our image. So let's take a look at our image. So we didn't get all 6 incisors, but as we said previously, Major is a larger dog. So when we rotate to the other side, we would get the rest of those incisors in our image. So at this point, you would rotate the patient's position and proceed with the same angles on the other side. For the sake of this demonstration, we're going to reposition him onto his back and just show the images from the forward part of the mandible again from that position.